Hi, this is February 6th, and I come to you today with less hair and less clutter. I have to apologize for the editing on this video. I'm really tired and out of it because of all the work I've been doing today. And I just lose my train of thought really easily. You see, I have now just about a day left until my surgery, and among the many things that I'm trying to do is cleaning up my room. And I got this haircut. I'm just hoping to do as much as I can to prevent little discomforts, I suppose, that I predict may happen during recovery. And yeah, I did say my room. I'm actually living at home right now. I'm actually in a real nowhere land position in my life right now in part because I expected this whole medical thing to be done months ago. Because had they been able to do it percutaneously, it would have just been that one back in the summer, which was September actually, and a couple months later, perhaps around November, they would have done another procedure to implant the valve itself. They would need to put in the stent before the valve. Now with the open heart procedure, it's just one thing. But with all that's happened, it's just dragged it on, and now I have a long recovery process, and it's just caused this very confusing part in my life in which I've been kind of hesitant to look for work because I know that I'm going to have to take a long time off of work, maybe as soon as I get it. Now that I'm going into surgery, I can finally just get on with things. I think that this is I think that it makes it a lot harder to be sitting around and doing nothing, waiting for surgery, because then all you really have to do is think about it constantly and think, what can I do beforehand? What won't I be able to do afterwards, and all that, instead of just going on with your day-to-day life, because I don't really have a day-to-day life. I'm running kind of low on time for making this, but I wanted to have my third installment here be a description of a little bit of what's been happening to me in the past year. Basically, I've had 2 surgical procedures. One was a catheterization, and the other was having my wisdom teeth pulled. So, I'll explain why those were. They put off this operation for a year, maybe a little bit more, because they were expecting me to be able to, because they were hoping me to be able to have it done not by open heart, but percutaneously. Now this technology is fairly new, and the main limitation of having a valve implanted percutaneously is that they cannot get it very large. It turned out that my outflow tract is too large to be implanted by those means. And however, this was pretty much known after my MRI, but they didn't tell me until I was literally in the pre-OR for the catheterization, and I had the IV in me, and then they brought in the consent form, which was kind of ridiculous. Usually they give you those before you're plugged in, so to speak. And they told me then that they thought that there was a very low chance that the operation would be able to result in me getting a valve. I didn't know that beforehand, even though I had met with the surgeon, of course, and I had discussed it with him pretty thoroughly. What he said caused me to think that it was a near 100% chance of working. So that just shows you that you have to ask questions like that, which seem obvious, which seem like you already have the answer. If you don't have a specific, clear answer, ask it multiple times. So I thought I would compare how that surgery went with having my wisdom teeth removed. Firstly, the anesthesia. So when I went unconscious for the cath, I lost my memory before I got to the operating room. I had general anesthesia for both of them, even though usually you don't have general anesthesia, well, for either of them. For the cath, they usually give you some kind of conscious sedation for wisdom teeth removal. One of the major things that they do, if not just Novocaine, then nitrous oxide. However, it was different for the catheterization because this was a trial study, actually. They were hoping to implant me with a valve that was much like other valves that have been thoroughly tested, but not itself tested for a long period of time. They knew that it was safe. It was just a larger version of one that's already in use. And at this time, they were going to stent me, and possibly, they said, if the procedure failed, if the stent slipped, it would result in me having open heart surgery to remove the stent and then put in the correct valve. So another thing that they were doing, they were running an angiogram to just see the insides of my arteries near there. They were looking at the pulmonic arteries to see if they needed to be stented, which fortunately they did not. That's a good sign. Unfortunately, they could not put the stent where they wanted to. Now that procedure, they went through my thigh pretty close to where the scar was that I showed you before, except higher up on my leg. And not big like that. It's just two little holes where they went all the way into the artery. So going under anesthesia for that, I lost my memory very early. For the wisdom teeth removal, I remember going into the OR. I remember even having the gas mask put over me, not being intubated or anything like that, which they inevitably did. When I woke up from the catheterization, it was very sudden, and I felt fine right away, except for that I had this really awful dryness of my mouth. And they were slowly giving me ice chips, and then after a while, the nurse there in the recovery room just gave me the cup full of them, and I had a bunch at once, and then I started to get a little nauseated. They gave me a little medicine for that, which worked, but that was a pretty bad experience waking up. After that, I was in a hospital room for, they wanted to keep me there for 6 hours after the operation just to monitor my heart, I suppose, because they had stuck something up into my heart, and just to see that I was okay when I was leaving. However, in my time there, I became extremely agitated. I was up, and even though I had this numb leg from the lidocaine or whatever it is that they put on there, I was walking around. I felt like I was going to jump out the window and run naked across the hospital lawn or something. I was just really antsy, and I couldn't concentrate on anything. It was just a horrible feeling. it was speculated that that might have been something called delayed emergence, or it might have been some kind of panic attack. I'm not really sure. After that, right as I was going home, I just sort of collapsed, and I couldn't really move much. And they wheeled me out in a wheelchair, which they wanted to do anyway. And after I got home, I slept for something like 14 hours. And I got up partway between that, and I almost threw up because I was extremely nauseated. The next day, however, I was fine. That procedure, my leg was bleeding for a few days afterwards. Then it was bruised. It took about a month for me to feel completely better, but I never needed painkillers or anything. So it wasn't too bad. The wisdom teeth removal, which I had because I have had 3 impacted wisdom teeth and one just kind of crooked, and they wanted to have these removed before my heart surgery to help prevent any endocarditis that might form in the new valve. I was going to have that done by laughing gas, nitrous oxide. I went into the office to have that done. I even got Novocaine in half my mouth, and then I either had some kind of panic attack or some kind of bad reaction to the oxygen or the nitrous oxide that he was giving me. And my muscles just completely stiffened up and locked like that. And I had a rapid heartbeat. But I've never had a panic reaction quite like that. My muscles don't lock up. So it's very strange that would happen outside of some bad reaction, which isn't even expected from those kinds of medications. So my dentist, my oral surgeon, being very careful, called it off and arranged it with the hospital. And that took so long that I ended up getting it only 3 weeks before my... Actually, I ended up getting it at the time I originally wanted to have this procedure. But I just moved it to 3 weeks later.